Welcome to an ODE-approved online refresher training for medication administration in schools. This training is only to be used by designated school personnel in the intervening years between in-person trainings. If you have never received an in-person training on medication administration in schools, this training is not for you. Please contact your district nurse for an in-person training opportunity. The law, OAR 581-021-0037 reads, the first training for designated personnel and every third training thereafter must be provided in person. During the intervening years, designated personnel may complete an online training that has been approved by the Oregon Department of Education, or ODE, so long as a trainer is available within a reasonable time following the training to answer questions and provide clarification. Oregon law requires that designated school personnel have annual training in how to administer medications to Oregon students. The law requires that designated personnel's initial training and every 3 years thereafter be provided in person. The law allows the intervening years to be done through an online option. This course meets the requirements for the intervening years as long as a qualified trainer is available to answer questions and provide clarification within a reasonable amount of time. Qualified trainers include Oregon licensed registered nurses, doctors, or pharmacists that are also familiar with the school setting. A school district cannot require you to administer medication if you have not received the appropriate training. You must review this entire PowerPoint presentation to meet the yearly training requirement. Your district is responsible to track compliance with the medication training requirements. Please check with a nurse or other district personnel for how your school is tracking completion of this training. It will also be helpful if you can reference the training manual that you received during the last in-person training. This manual is also available on the ODE government website. We will reference specific page numbers through this online training. Page 3 of the manual describes the legal background of the medication laws. Oregon Revised Statute, or ORS, 339.866 to 339.874 are the statutes that give districts the authority to administer medications and/or allow medication administration in the school setting. OAR 581-021-0037 is the Oregon Administrative Rule, or OAR, that ODE maintains to further describe the specifics of medication administration in the school setting. The ODE rule requires that designated personnel must receive training before administering medications. There must be district-level policies for medication administration, including self-administration. This course only includes non-injectable medications. There are other trainings available for glucagon, epinephrine, and medication to treat adrenal crisis. Participants will be contacted if those are necessary within their job duties. Those injectable medication trainings are only done in person. District policy must address how personnel are to be designated to be trained to administer medications. For consistency and safety, it is best to have one primary person who is familiar with the student and the task. The more people involved, the more room for miscommunication and errors. However, there should always be enough backups trained and available in case the primary person is absent or cannot accompany the student on an off-campus activity. OAR 581-021-0037 requires that each school district adopt policies and procedures for administration of medications to students by trained school personnel and for the student self-medication. Because Oregon is a local control state, there may be slight variation in policy from district to district. Please check with the registered nurse in your district, if available, for any questions about your district's policies and procedures. If a registered nurse is not available, please check with your building or district administrator. Page 3 and 4 of the manual explain that district policies and procedures must include a process to designate, train, and supervise appropriate personnel for medication administration that takes into account when a student is in school, at a school-sponsored activity, under the supervision of school personnel, and in transit to or from school-sponsored activities, or school. This will include school-sponsored activities such as field trips, athletic trips, outdoor school, and band trips. Special attention must be given to events such as overnight trips that will include medications that may not typically be given at school. In addition to the information on the previous slide, state law requires that special consideration be given to students with a diagnosis of severe allergies, adrenal insufficiency, and/or asthma. For students with one or more of these diagnoses, district policy and procedures must address before school and after school programs on school-owned property. Page 5 of the manual contains the definition of medication. Medication means any drug, chemical compound, suspension, or preparation in suitable form for use as a curative or remedial substance taken either internally or externally, but not injected, except for pre-measured doses of epinephrine for severe allergic reaction, medication to treat adrenal insufficiency, and glucagon to treat severe hypoglycemia. Medications may come in various forms, including capsules, tablets, liquid, lozenge, creams, ointments, eye drops, and inhalers. These will be discussed in more detail in later slides. Prescription medication administered in Oregon schools must be given under the direction of one of the prescribers listed on the slide. These prescribers must be licensed to practice in Oregon. Since this list on page 6 of the manual includes more than just doctors, the following slides in the training manual refers to prescriber rather than just physician. Non-prescription medications are discussed on page 5 and 6 of the manual. A non-prescription medication is a medication that under federal law doesn't require a prescription from a prescriber. The requirements for non-prescription medication in the school setting includes: the instructions must be consistent with manufacturer guidelines, necessary for the student to remain in school, an original container, parent or student under specific situations must transport, signed consent from parent or student in specific situations, written order from physician to address inconsistency with manufacturer guidelines. If you have any questions about these requirements, please contact a registered nurse in your district. Non-FDA approved medication rules are described on page 6. Medications and supplements that are not FDA approved have not been tested for efficacy or safety, particularly for the pediatric population. If a prescriber is willing to sign off on the safety of a medication for the student, however, it will then be treated like a prescription medication, and the prescriber's orders may be followed. The list of requirements for non-FDA approved medications are listed on the slide. The easiest way to identify whether a medication is FDA approved or not is to look at the label on the original container. If it contains a drug fact label, it is an FDA approved as a medication. If it contains a supplement or nutrition facts label, it is not FDA approved as a medication. In these cases, it can be given, but only if ordered by a prescriber with verification that is necessary during school hours. Page 6 and 7 of the manual. Prescription medications are those that require, under federal law, a prescription from a prescriber. The requirements for prescription medications are listed on the slide. In addition, the medication must be transported to school by the parent or guardian or eligible student. Instructions must be consistent with prescriber prescription. A parent guardian cannot adjust the dose or frequency of the medication without orders from the prescriber. Those orders must be received by a nurse. Page 8 of the manual. These are the 6 things personnel should triple check every time they administer a medication. prescription, and non-prescription to a student. Personnel should do an initial check as they remove the medication container and the student's medication administration record, or MAR, from the cupboard and compare the label to the signed parent permission instructions. Perform a second check of all 6 rights as they dispense the medication and administer it to the student. Perform a final check as they place the medication container and the MAR back into the secured storage area. It is common practice in Oregon schools that a medication administered within 30 minutes of its scheduled time is still the right time. Anything beyond 30 minutes is a medication error. Medication error reporting allows the registered nurse to assess the situation and provide additional training or change systems, if necessary. The right time for medications ordered to be given at lunch or before lunch will vary depending on the student's schedule. Starting on page 9 of the manual, we discuss how to handle medication administration. Water used for a student to take medication should not be drawn from the same sink that is used for first aid care. This is for hygiene purposes. If there is only one sink, an option is to have a separate large water dispenser or to fill a covered pitcher with water from a clean source each day. This is so the sink can still be used for first aid. School personnel and students should wash hands before and after administering medications. If possible, it is best not to touch the medication after you have retrieved it from the original container. This can be accomplished by using the cap or a tissue to avoid contact. If you must touch the medication, wear gloves. Some medications require special preparation before administering, but not all of this preparation is the school staff responsibility. Tablets that need to be cut must be sent to school already cut. The parent or guardian must provide a pill crusher for pills that need to be crushed. The parent or guardian must provide a calibrated measuring device for liquid medication. Household utensils such as teaspoons are not accurate for medication measurements. Page 10 of the manual. Medication comes in many forms and is administered in various ways. One method of administration is oral or by mouth. As you can see in the slide, tablets, capsules, syrups, elixirs, and suspensions are all examples of oral medications. Another common example is lozenges or cough drops. Indicated on page 10 and 11 of the manual, another route is topical, or on the outside of the body. These may be creams, ointments, lotions, or patches. Common examples are triple antibiotic ointment, hydrocortisone, or calamine lotion. Page 11 and 12 of the manual. Another common route of medication administration in the school setting is inhalers. Inhalants can be given nasally or orally. Asthma inhalers are given orally to deliver medication to the lungs. There may be special instructions with various inhalers. Occasionally, students will bring in a nasal spray to be administered in the school setting. This slide contains a list of medications that need additional training before school personnel are allowed to administer. The registered nurse in your district will provide the additional teaching necessary. School personnel cannot legally administer medications through routes/procedures that they have not been trained on. To do so could be considered practicing nursing without a license, which is against the law. On page 12 and 13, the manual discusses safe storage and handling of medications. Medication must be received at school in its original container. Medication should be kept in a secure locked area such as a cabinet or drawer. This should be in a location that is convenient for school personnel to access and monitor for security purposes. It is preferable to store emergency life-saving medications such as inhalers in containers or locations which allow them to be quickly removed and transported in the event of an emergency or drill. The parent guardian must bring medication to school and pick up medication to take it home. The only exception is for medication that a student is taking legally without parental consent. The medication must be kept in its original container. Do not empty medication from its original container into any other storage device. Some medications require refrigeration. This can be accomplished by having a dedicated medication refrigerator or a lockable section in a refrigerator to keep medications separate from other items that may be kept in the same refrigerator. The refrigerator temperature should be maintained between 36 and 46 degrees Fahrenheit to ensure the medication's viability. It is best practice to practice the plan for medication removal in an event of an emergency during school emergency drills so that personnel can be designated and trained on the procedure in advance of an actual emergency. Life-saving medications in particular should be brought out and kept in close proximity to students during drills and emergencies. When any medication is brought in for personnel to administer, whether it is a prescription or a non-prescription med, the parent or student must fill out a medication form. You will see an example of this form in the following slides. Personnel will also establish a medication administration record, also known as a MAR, for the student at this time, upon which all administrations and comments may be documented. Personnel should be sure to check expiration dates on medications as they are brought in. Do not accept expired medications. If a medication is to be used throughout the school year and you see that it will expire partway through the year, make note of this on the MAR and remind the parent that they will need to replace the medication before it expires. For the student's safety, school personnel cannot administer expired medications. If the medication needs to be counted, this should be done at this time and documented on the MAR by the trained personnel accepting the medication from the parent or student. Changes in medication instructions requested throughout the school year must be consistent with manufacturer guidelines and/or reflected by a new prescription label or prescriber's note with signature. Any medication not picked up will be disposed of appropriately by school personnel. Most schools send several notices to parents beginning in the spring, reminding them that they will need to pick up the student's medication within 2 days of the last day of school, or the medication will be destroyed. Personnel should follow their district's policy on medication disposal if they have one. If they do not, follow disposal instructions on www.fda.gov. It is no longer acceptable to practice to flush down the toilet or pour down the drain. Other options may include take-back collection programs, or removal from container mixed with undesirable substance such as pencil shavings or used coffee grounds and place in an impermeable plastic sealable bag. Discard and trash as close to pickup day and time as possible. Student information should be removed or thoroughly concealed with marker before discarding bottle or container. Page 13 of the manual. As briefly mentioned in the previous slide, some pills require close monitoring of the quantity of medication. In these cases, medication should be counted with the parent guardian or second school personnel when received at school and again when the medication is removed from the school. The list of controlled substances requiring counting are included on the slide. If personnel are unsure of whether or not a medication being brought in is a controlled substance that requires counting, they should go ahead and count it. There is no harm in counting any medication. Better to be safe than to miss something important. Medication counting should be done at the time that the trained personnel is accepting the medications from the parent and should be documented on the MAR. Discrepancies should be reported to the school, nurse, or building administrator and parent guardian immediately. Page 14 of the manual contains information about documentation and record keeping. The form on the slide is an example of the form that needs to be signed by a parent or student under certain circumstances for any medication being administered by school personnel. The parent or student must fill out the medication information, and the personnel accepting the medication must check the parent instructions and information provided against what is on the prescription label, or in the case of non-prescription drug, against the manufacturer's recommended dosing guidelines for the age of the student. If a parent wishes to have their student self-administer and carry their own medication with no assistance or documentation by school personnel, they need to fill out a different form, which will be discussed in the following slides. Medication administration must be documented. There may be variation from district to district depending on local policy and the use of electronic health records or other school health documentation process. This is an example of an official medication administration record, or MAR. The MAR must include full name of student, date of birth, name of medication, dose, method of administration, and frequency. When any medication is brought in for personnel to administer, whether as prescription or non-prescription med, the parent or student must fill out a medication form, and the trained school personnel accepting the medication must establish a medication administration record, also known as a MAR, for the student at this time, upon which all administrations and comments may be documented. Personnel should be sure to check expiration dates on medications as they are brought in. Do not accept expired medications. If a medication is to be used throughout the school year and you see that it will expire partway through the year, make note of this on the MAR and remind the parent that they will need to replace the medication before it expires. For the student's safety, school personnel cannot administer expired medications. If the medication needs to be counted, this should be done at this time and documented on the MAR by the trained personnel accepting the medication from the parent or student. Changes in medication instructions requested throughout the school year must be consistent with manufacturer guidelines or reflected by a new prescription label or prescriber's note with signature, and a new parent permission for medication form must be signed by the parent. Each row of the MAR represents 1 month of administration on one particular medication and dosage, and has 31 days in which to sign verification of administration, or to enter a code for any circumstances, events that resulted in not administering the medication as directed. In such a case, there is a list of codes to choose from along the top of the table. Personnel should enter the appropriate code and write a short, dated, and signed comment in the spaces provided throughout the MAR. For clarity, there should be no blank spaces on the monthly row for a daily medication. Cross out any weekends and non-school days for that month. The initials of the personnel administering the medication should be in the corresponding box for the day once the medication has been given. If the medication is not given for any reason or the student is absent, this should be documented in the box for that day, using the appropriate code from the list provided on the MAR. If a medication is discontinued partway through the month, or if the parent does not bring it in until partway through the month, a simple line should be drawn midway through the date box, up until the date the administration will begin, or starting on the day after the last dose was administered. There should be an area on any medication administration record, or MAR, for trained personnel to sign the medication in and out, and to document the pill count as necessary when the medication is initially brought in, or per district procedure. All personnel administering medication should also indicate their name next to their initials on this page of the MAR so it is clear whose initials are entered on each day of administration on the official record. It is best practice to keep all medication administration records, or MARs, locked up in the same secure location where the medications are kept. These should not be in a separate location from the medications, or personnel will be unable to triple check the 6 rights of medication administration while administering a med, nor be able to immediately document their administration. Personnel must document every time a medication is given. Documentation must be accurate, legible, and completed at the time of the administration. Document in blue or black ink only, no pencil. If a mistake is made in charting, cross it out with a single line and mark ME, mistaken entry. Do not use whiteout. Referring back to page 7 of your manual, Oregon law requires districts to have policies around student self-administration. This means that no assistance and no documentation by school personnel is necessary beyond obtaining the initial parent or student signature on a self-medication agreement. To self-administer, the student must be able to demonstrate the ability, both developmentally and behaviorally, to self-medicate with written permission from parent or from student pursuant to ORS 109.610, ORS 109.640, and ORS 109.675. Building administrator and prescriber or registered nurse practicing in the school setting. Check with your school district for a self-administration policy and written agreement for all parties to sign. This agreement may be revoked at any time if the student is unable to comply with the agreement. This is an example of a self-medication agreement form. It should have a signature line for parent, student, school administrator, prescriber, or RN practicing in the school setting. Page 14 of the manual discusses confidentiality. Student medication records are considered a part of the education record under FERPA law. Only those school staff with a legitimate educational interest are allowed access to these records. Medication records should be filed at the end of the school year. Place record in student's health folder in the cumulative file. If medication administration is included as a related service on an IEP, the medication record is placed in the special education file for the student. Occasionally, medication errors happen. Report medication errors immediately to the parent, building administrator, and the school nurse. The following actions constitute an error: medication not given, medication administered to the wrong student, wrong medication or wrong dose given to student, medication given at wrong time, medication given the wrong way or route. Most districts have a form to document medication administration errors or near miss. Check with your district. Do not be afraid to report a medication error. For the student's safety, the sooner you let the appropriate people know what has happened, the sooner they can begin to rectify the situation and monitor the student for effects. In rare cases, trained staff may be necessary to treat life-threatening side effects. This could include the use of epinephrine by trained school personnel, CPR, or calling 911. Page 16 of the manual. During field trips or other off-campus activities, teachers, administrators, and office staff should be mindful of students with scheduled medication needs and emergency life-saving medications. School offices should have procedures in place to coordinate field trip requests with a check for any students who take medications during the time that they will be under the supervision of school personnel. Districts must be sure to arrange well in advance the training of an appropriate amount of personnel to adequately accompany students with medication needs. Medication administration records are generally not taken on field trips and activities. School personnel accompanying a student needing medication should be fully aware of the student's condition and medication treatment, including possible side effects and reactions to watch for. The personnel will then document administration on the MAR when they return to school. In the event that a district has not planned in advance for the health or medication needs, accommodations of a student, and there are not appropriately trained personnel available to accompany the student on the day of the trip, the district must cancel the entire trip or activity. It is a violation of ADA to remove only the student with medical needs due to inadequate district planning. Oregon law requires that you have access to a qualified trainer within a reasonable amount of time to answer questions or provide clarification of this training. If you need this support, please reach out to the designated registered nurse, doctor, or pharmacist. Your district is responsible to track compliance with the medication training requirements. Please check with the nurse or other district personnel for how your school is tracking completion of this training. Thank you.